Aspivix presents Carevix Suction Cervical Stabilizer. Preparation and use of Carevix for trans-cervical procedures. Always consult instructions for use before use on eifu.aspivix.com. Carevix is a suction cervical stabilizer to grasp, hold, and manipulate cervical tissue. Ensure the subject aligns with suitability guidelines. Use aseptic measures before using Carevix for trans-cervical procedures. Correct use of Carevix. Open the box from the side. Open the sterile package on the chevron side. Follow standard medical practice to handle a sterile Carevix. Assemble the device. Connect the suction head to the main body. Align the connecting thick marks found on the suction head and the main body. Rotate only the main body clockwise until it stops, and the thin mark on the main body is aligned with the thick mark on the suction head. Check the button position. The side with the solid oval should face up. If not, pull up the button. Generate the vacuum outside the subject. Pull the piston away from the main body until it stops generating the vacuum. An arrow will be visible at this point. Rotate the piston counterclockwise until it stops. Two thin marks will be aligned. Disinfect and dry the cervix with a sterile swab. Hold the cervix. Place the suction head firmly against the healthy tissue of the cervix at 3 o'clock or 9 o'clock to achieve a good seal. Clinical experience demonstrates excellent grasping quality for anteverted and retroverted uterus at 3 or 9 o'clock, but can still be placed at 12 or 6 o'clock. Press the button to deliver the vacuum, relieve the pressure on the cervix, and wait 10 seconds. 10 seconds are necessary to allow the tissue to enter the suction head. The tissue creates the sealing. The more tissue enters the suction head, the better the pulling effect. Manipulate the cervix. Pull the main body straight and slowly to align the cervix with the uterus body, maintaining the seal with the cervix. When Carevix is combined with an intrauterine device inserter, it is necessary to adjust the position of the flange by adding 1 centimeter to the measurement performed with the hysterometer. For a hysterometry of 7 centimeters, the flange should be placed at 8 centimeters. This adjustment is made because the flange meets the suction head. The device still holds the cervix perfectly, and the intrauterine device is in place. Cervix release and removal of Carevix. Press the button side with the hollow oval shape upwards to release the vacuum. Disposal. After use, discard Carevix according to local regulations for biohazardous waste. Use of Carevix in the operating room. The physician dries the cervix. As the physician is right-handed, and according to the patient's anatomy, she decides to place Carevix at 9 o'clock. It is also well suited for multiparous subjects with a horizontal external ostium. The physician pulls slowly in the axial direction to align the uterus. Reset Carevix in case of spontaneous release. Be sure to press down on the solid-shaped side of the button. Rotate the piston to unlock it. Push the piston into the main body until it stops. Pull up the button before regenerating the vacuum. Pull on the piston and lock it. Carevix is now ready. 4 tips to become a Carevix master. 1. Ensure good contact. Push enough for good sealing before hitting the button. Hearing air noise means you're sucking air and not the tissues like you hear now. In this case, reset Carevix. 2. Don't place the suction head too close to the cervical canal to avoid its suction. Place the suction head a few millimeters next to it. If you hear a whistling, you are sucking air and not the tissue, as you can hear now. In this case, reset Carevix. 3. Push on the cervix to ensure good contact. Press the button to activate the vacuum. Release pressure on the tissue. Relax to allow the tissue to move into the suction head, ensuring a good sealing, and wait 10 seconds. Test on your hand's skin with a demo device to feel it and understand the importance of waiting 10 seconds. 4. Pull straight and avoid angles to prevent peeling. MyAspivix.com is our training platform for professionals, where you can find additional educational material, such as our e-learning platform, our online simulator, our toolkit, and much more. Thank you for watching this video.